Welcome to Nursing 5901 Advanced Clinical Practicum. This will serve as your introduction to the course. We will have additional videos and/or Zoom sessions that provide more detail about specifics, and this is considered an overview just to familiarize you with some of the basics that you need to be prepared for the semester. The focus of Nursing 5901 is to enhance and optimize your clinical expertise in the profession of nursing. Notice that clinical is highlighted, meaning that the focus of this course is not to be a better administrator, it is not to be an educator at this point. It is to focus on making sure that you have the most clinical knowledge and skill that you need to educate students or educate practicing nurses in the future. So you have to think about where do you want to go with your career in terms of determining where do you want to broaden yourself out. If you have been in an administrative role, for example, and you have not done a lot of clinical current practice, then maybe you pick something very generic where you can get the most broad-based clinical expertise working with patients. You might be somebody who currently has a very active practice in the inpatient side of care, but you have no experience in ambulatory care. Maybe your long-range goals are to be more engaged where you know that whole care continuum. And in that way, maybe you want to choose something that is more outpatient related in terms of improving your clinical competency. Or you might be in a specialty area. For example, maybe you're a pediatrics nurse, but you've never worked pediatric intensive care, and you know that if you're going to be a pediatrics instructor down the road, you may have to have experience in multiple units, not just a general unit. So it's important to really think about what is the focus, because that helps you choose an optimal clinical site, and you will work on your goals around kind of what your end goal is for your career with this course. I'm going to go over a few different steps to success. Number one, select an approved clinical site. The Department of Nursing at Appalachian State has numerous existing clinical sites that we work with and already have contracts with. If you live in a different part of the state, that's okay, because we often have contracts all outside of our region somewhat. And it's important to note that if we need to do a new contract with a new partner for you specifically, sometimes those contracts may take a couple months between the two agencies to hammer out. So getting that information back very quickly to our Director of Academic Support and Program Compliance is very important. And that position is the one who is responsible for searching for and finding a qualified preceptor who is master's prepared in the agency or in a site that kind of fits your needs. And that person will notify you with your site and your preceptor's name and contact information, so that you can connect with them. Please do not set up time to go meet with them in advance of the beginning day of the course. We cannot provide any hours that are part of your amount of hours you have to complete that start prior to the first day of class. So just keep that in mind. It's fine to have a contact. It's fine to talk with them per phone to kind of set up some different times. That's optimally a great way to get started, but your first day of clinical can only start on the first day that classes start for the semester. Number two, you're going to complete a self-assessment and develop and submit your individual learning contract plan for approval. It's ideal to pick a self-assessment method that kind of mimics or goes along with the care setting or the clinical setting that you're going to do your preceptorship in. Many facilities may already have developed like nursing checklists that have all the skills or the knowledge or different things that they get measured on. It might be if they don't have that, they may have like a job evaluation that lists all the different things that someone gets measured on. And just remember the whole idea of self-assessment is where you're trying to identify what am I already competent in and what do I really need to enhance my knowledge and skill in, and then look for setting up your learning contract and your outcomes goals along the things that you really want to accomplish and improve upon, and get more expertise in. It's also ideally important for you to go ahead and review the planning resources folder in the course so that you see what some of the templates are. Start looking on how those are to be set up, and there's some good information that's there. We'll also have a Zoom session a few weeks into the course so that you can ask questions and get some more feedback about that. And as you turn in these contracts for approval, I may give you edits and give you some more feedback about how to optimize those. But there's also a preparation video that you'll see in the course that gives you some more detail on this. It's important to note that the learning outcomes contract does account for 50% of your grade, so you really want to do well on that from the beginning, and so it can be measurable on the end of it when you go to evaluate how well you've done. Number 3, you're going to actively engage in learning in the clinical setting. You do have to complete 90 clinical hours under the direction of your preceptor. That does not mean that you work side by side with your preceptor every single day they come to work. They can look at your goals and your outcomes that you would like to achieve. They can assign you to go to different activities in their organization. That might be committee meetings where you can learn a lot more about something. That might be CEU offerings that they have at their agency. It might be that you're working with another nurse that you work with in a setting, and then as you gain some expertise, then you meet back with the master's preceptor who gives you some more feedback and kind of touch base with, but you're not sitting in their office every day, all day with them alone. That's not the idea. The idea is for you to gain the expertise that you have already kind of predetermined is going to benefit you the most as part of that 90 hours. You do have to complete the full 90 hours to get credit for the course, so it's important to plan accordingly to be on track with that over the 10-week semester. Number 4, you're going to document your learning and successes. You'll do this by maintaining an ongoing clinical practicum reflection log. There is a template in the course for that you can look at. Familiarize yourself with that. It will be required to be uploaded twice per semester, at midterm and then the last week of the course. And then you will get grades based on how well you have met. There's a grading rubric specific to what's supposed to be included on the reflection journal. And the reflection journal does account for 10% of your grade. It's also important, at least weekly, to make sure that you note, review a scholarly article that pertains to the clinical setting or your learning goals for that week, and just so that you're showing that you're staying kind of current in the things that you're doing. You're also not just looking at practice that you're observing, but also going out a step further to make sure that that's really the most current practices that should be used. Number 5, Clinical Standards of Care Group Project, which is supposed to account for approximately 30 clinical hours, although you do not have to map this out. The idea is to identify a partner with similar clinical interest, together research current clinical standards pertinent to a specialty area or to a specific clinical standard in healthcare. Select a priority standard that you're going to gather as a team evidence-based literature on. You're going to post a summary of that literature in PDFs or resource links on the discussion board for other students so that they have something to look at and review. You will prepare a synthesis report, and there is a folder in there that has some examples of evidence-based literature reviews and how those can be organized in a table format. And once you get that organized, you're going to post that for students. You will also be responsible, your group, you can choose how you and your partner do this, but you'll lead a discussion board for the assigned week related to this standard. You'll participate in additional discussion forums that are held by the other groups that are being done as well. And in terms of grading, the clinical standard group project accounts for 40% of your grade. The synthesis report is 15%. The resources that you prepare for your colleagues are 5%. How you lead and set up the conference discussion board is 15%, and then your active participation in other group conferences of other groups is 5% of your grade. Number 6, evaluate your success and evaluate the course. Near the end of the semester, you're going to evaluate the progress that you've made on your learning contract. And each outcome goal, you will write out some information about how you met it, provide some documents or evidence, things that you might want to upload additionally with your learning contract that shows how you met those particular goals. You will meet with your preceptor close to the end of the semester to look at how have I come so far during this time in meeting these goals that we set up together in the beginning. And then once that is completed, you will upload your contract for faculty review and some further input. It is also very common for the instructors to meet with or set up or request like Zoom interview sessions with both the preceptor and the faculty and the student as a trio together. So making sure that you kind of be thinking about when might we do that on one of the last days of clinical is really important, and set up with your instructor for the course to see, what's a good date and time that matches with that. And then finally, we want to get a good evaluation of all of our courses at the end, and within the course itself, you will have a course evaluation. And you may be asked some specific questions about the clinical side or the clinical agency at the end of the course via a survey that comes to you for additional information about your preceptor and the clinical agency that you were in. Hopefully this has given you a good overview of the course, and as always, feel free to email your instructor with any specific questions that you may have at the conclusion of watching this video.